Here is the MRI that we are going to study. Get it from your MRI center. We put on the information on it. And we are going to open that on the computer and see what went wrong. The injury is frightening. The severe injury happens when you crank the handing, when you crank the landing gear of a commercial tractor. All that is, it might help, it might not. The injury is exactly, look at the hand, here is the thumb, the first metacarpal, the second digit, the third, the fourth, and the fifth. The injury is right here, that bone. That is the scaphoid bone. And that is the leonate bone, and that is the radius, the medial part, and that is the ulna. In that portion here, the ligament between the leonate and the scaphoid is torn. So if I bend my finger, this bone will come up, will pop out, become very severe. It will cause arthritis and pain in the hand and numbness in that portion of the hand. If I bend this way, there is a severe pain right here. The pain is also right here. There is a little pain here. I will show you the diagnosis later on. If I try to grip something, I can grip anything strongly, no problem. I can pull, no problem. I can push also, but on this part of the hand, not on this part. Once I twisted the hand this way, the pain is here become very severe, this location. I keep using it, the ligament will never heal. And so the bones become flail. They don't stay in place, so they interfere with the ligaments. Because numbness, you lose your hand. So the surgeon saw the bones were eroded inside, degeneration of the bones, of the cartilage of the hand bones. You have 8 hand bones here. And you have two wrist bones. Some of the bones have degeneration around them. If you open to try to reconstruct the ligament, you might have problems because of the arthritis. Might not be successful. So his idea was to open and to do any one of about 11 operations, either to remove the bone and diffuse the other bones, or to do some cleaning. Any operation in the hand is going to be devastating, very involved. Now I have my hands. If I do surgery, I will not have my hands. This is the left hand. Start throwing arthritis here. Start throwing some arthritis at the finger. I will do the MRI on it next week. But this hand does not have torn ligaments, does not have collapse of bones, because this is the left hand. Now, if I'm not using the right hand, the left hand will follow the same course, so you're going to lose both hands. So what I'm going to do is that you become educated. You just have to wrap your hands. This is one way of wrapping it. This is another way under it. As you can see, it goes under. This is a physical therapy. They give you this stuff. They help. And then you have to exercise. And you have to put heat on the ice. This is the first layer of. So this is a very good idea. It keeps the bone together at least. Support, like skin. This can be good and can be crippling. If you use this all the time, you're going to have stiffness, and you're going to have muscle degeneration, and the torn ligaments are going to be worse, and the arthritis will be worse. So you use this in certain situations to avoid acute damage when you do anything with it, and you take it off when you don't need it. This one is going to go through a process similar to that, since this is the only one I have it now that does not have collapsed bones and ligaments. So I need to keep it as long as possible so I can stay functional and earn my living. The space between the radius and the scaphoid here is normal. There are no collapse. The lunate, this is the lunate right here, and this is the scaphoid. They are connected with the ligaments. They are not torn. The other bones are okay because I did not use it much. This is the one that is damaged, classified as advanced stage 1 and stage 2 collapse of the hand bones with a torn scapholunate ligament, a traumatic collapse with mild arthritis, with restricted use, and referred to a hand surgeon and physical therapy, and I am out of work for a while until I get this hand working. And this hand, I need to keep it as much as possible because this is the only one that can function without surgical problems. That is the story so far. So let us go to the screen and open the abs of the MRI, and I will try to do my best to understand my situation and to educate you about how to avoid that so you don't fall in the same problem that I'm facing. This is already have gone to OSHA in a multiple claim. A claim of retaliation against the whistleblower that OSHA is investigating and accepted it against Walmart. A claim of harassment by Walmart manager. See, Walmart does not harass people. People inside Walmart harass people because Walmart is a giant company, a big company. It has a lot of rats and crooks hiding in the cracks. But that's 4,000 stores, 76 distribution centers, loaded, filled with dysfunctional criminals, uneducated about industrial safety and health engineering. So instead of removing the unsafe issues, they remove the drivers, and the manager hides behind the routines, the protection of his peers. You have one manager on the top of the other. The top, yeah, start from the safety manager is an ignorant crook, never drove a truck, does not have any education in industrial safety, never cranked a landing gear. On the top of him, you have a general transportation manager, generally either a bachelor degree or even high school diploma or maybe a master degree, the most you can get. That manager never in his life drove a truck, doesn't know the difference between the red airline, the blue airline, how to crank the trailer, how to lubricate the gears of the trailer, how much damage you get when you crank 2 or 3 trailers a day, how many times you crank a single trailer to raise the landing gear, how many times you crank it to lower the landing gear, the proper coupling and uncoupling process that is described by the manufacturer. That is a devastating situation. If you don't know, you are a manager and don't enforce the manufacturer recommendation for coupling and uncoupling, you ended up by having every driver having a damaged hand, not a damaged hand. Driver can fall between the trailer and kill himself. That is so far the situation as we We start from here. This is the X-ray of the right hand. How do you know it is the right hand? Because the radius is on this side and the ulna is on this side. So this is the right hand X-ray. The reason we are going to use it is because it shows you what is supposed to be normal. The S is the scaphoid bone, that is the scaphoid, and that is the leonate bone, and that is the triquetrum. Those are the three bones that are sitting between the hand and the wrist. The wrist is from here. This is the wrist joint. The radius is the forearm bone, and the ulna is another forearm bone. Troubles happen if there is any disarrangement or disturbance to these relationships. The first finger is the thumb. The second finger is the index. The third finger is the middle finger. And the fourth finger is the ring. And the fifth finger is the little finger. So the first row of carpal bones are these three rows, three bones. The second row, I think that the capitate and the hamate bone, pisiform bone, I think this is connected to the triquetrum. And then so that is 1, 2, 3, 4. Trapezoid is here, and the trapezoid is here. That is two bones in this location. So that's 4 here, that is 6, and 2, that is 8 bones. Those are the hand bones. Then you have the knuckles. Those are the knuckles. Those are the four knuckles. I think you have here the knuckle for the thumb. So what do you learn from this picture? You learn about the spaces between the different bone, how they're supposed to look like. The most important spaces here is these two, the leonate and the scaphoid, supposed to be adjacent to each other, not supposed to be separated. When you are going to see my MRI, you are going to see where the damage happened. Let us go to the next image or the illustration. Here is a very scenic X-ray. This is the radius, and this is the ulna. These are the forearm bones. This is the leonate, and this is the scaphoid. That shadow here is because of the X-ray have to go through bones. So you see this shadow right here. Is it a ligamentous attachment? It might be. We're going to see that in the next one. This is the scaphoid, as we said. This is the leonate, and this is this part or pisiform. And let us go back again to remember. Okay, this is the triquetrum, pisiform, then hamate, and then capitate. Let's go back again here. So this is the capitate, the big cap in the middle, and this is the hamate. And these two bones are, as we said, trapezium and trapezoid. These are the two bones that make the angle between the thumb and the second finger or the index. So we are here now. So these two bones are, the reason they are here is to allow the thumb to come out in a different direction, to stay away from the four fingers. And these four fingers are attached, are sitting on the hamate, the capitate, and the bone number 5 of the carpal bones. Where is bone number 8? As you see here, they are 7. 8 is the pisiform, sitting in that location. When you look at The spacing, which is our concern here, you have to have a cartilage here between these two bones. That is, when this cartilage is damaged, you have severe hand or wrist pain at a certain angle. As you can tell, our injunction with the radial bone here, but this bone is the ulna, has connection with the radius in this joint. It does not have cartilage connection with the hand. This is the most important anatomical fact, and you needed to have all these spaces between the bones intact to make sure that the bones are moving together as a block. What else can you learn before we go to the pathology or the damage? You also need to realize that each bone has a very specific contour. If you trace the bone, it has a contour, which means borders. It's not damaged. When the bone is damaged due to arthritis or injury or trauma, this contour will be disturbed. So as you can see, each bone has a very solid, definite contour in order to be able to tell that the bone is intact. Look at this bone, it has a contour, solid contour. You can say, well, it has a sharp point here. We'll figure that out later on. And this is a micro structure in the bone. This is the blood cavities or the cavitation of the bone. That's the normal process where the bone gets its own nutrition. You don't see the cartilage between these bones because this is an X-ray, it doesn't show the cartilages. So let us now go to the next image. This is when the hand is damaged. As you can tell, the radius is damaged. So the surgeon have to put a prosthesis here for implanted inside the radius, and they have to fuse the three or all the hand bones. All of them are fused except these two bones at the base of the thumb, the TM, the trapezium, and the trapezoid. So now we remember the trapezium and the trapezoid here are not fused to allow the thumb to move, but the rest, all the 5 bones are the scaphoid, the leonate, and the triquetrum, and the hamate, and the capitate. Those are fused with these nails. So the hand becomes a solid what? A solid. You cannot bend your hand at the wrist here, or you can. I don't know. Here is a very interesting illustration. This is the ulna. This is the ulna. And this is the radius, the forearm. As you can see, the ulna does not articulate with the hand. There is no articulation here with the hand between the ulna and the hand. The articulation comes right in this between the radius and the scaphoid and the leonate. Here is the leonate, this is small bone, and here is the scaphoid, this is large bone. And here is the side. This side is a ligament. They call it a radiocarpal joint ligament on the side that holds the radius to the scaphoid. The scaphoid has how many ligaments? One ligament goes between the scaphoid, the leonate, and the scaphoid, and the triquetrum, and the scaphoid, and the capitate. So you have 3 ligaments. That is one ligament in this direction, one ligament in this direction, and one ligament is under it like here. So there are 3 ligaments. If that one is cut, this bone will be separated. If that one is cut, this bone will come out. That would be a disaster if you have two torn ligaments. If that one is cut, the capitate and the scaphoid will be separated. If the ligament between the scaphoid and the triquetrum is cut, they will be separated. If that ligament is cut or torn, be separated. If here a ligament between the radius point and the triquetral. That is the ligament that holds the hand, prevents the hand from bending forward too much. And that is the most important ligament that surrounds, it goes around like this, surrounding the ulna, and allows the ulna to spin. The ulna can spin this direction. This ulna can spin in this direction, and it can spin in this direction because it has an annulus ligament around it. So our main focus today will be those three ligaments. That's one ligament between the scaphoid, one ligament between the scaphoid and the triquetral, one ligament between the scaphoid and the leonate, one ligament between the scaphoid and the capitate. Those three ligaments are going to be our main concern when you fall or you crank the handle of a landing gear of a truck and you get hurt on that location and you tear the ligaments. Depending on how serious the damage is, can you get the hand to function again? Do you have to have surgery? Is the surgery going to be a permanent disability? Is it going to be partial disability? Let us complete the illustration before we move to the next real situation. What we have here now, we discussed these three ligaments. We discussed these ligaments. There are other ligaments between the hamate and the fifth digit, the punky, and there is another ligament between the hamate and the fourth, between the hamate, between the capitate and these two. As you see, each bone is connected to each knuckle or the finger in order to allow the bones to be tied together, to articulate together, or ligamentous articulation versus cartilaginous articulation. This is ligamentous articulation, which means ligament, and two bones are connected by a ligament only, the ulna and the radius. There is no cartilage between them because they need to be free, or they might be cartilage. Let us forget about that now. But this is the scaphoid and leonate are articulated with the radius bone with a cartilage, and that when this cartilage is gone, is destroyed, you have severe bone in the hand, and the rest of the carpal bones are connected to each other with ligaments and cartilages. This is for now. What else do we need? This is the MRI, the CD that was supplied by the laboratory, the X-ray laboratory. Here is the program, the executable, the transit. It's called EXA Konica Minolta. And we have two MRI, one for the wrist and one for the hand. So we are going first. The hand doesn't have a lot of information in it. Let us start with the wrist first. In the wrist, as you see, we have a localizer, TR transverse, I guess, localizer S, axial, BD, axial T2, coronal T1, coronal GRE, coronal BD. Let us start from the beginning. This is the first one, and it has 5 sections, as you see from, if you watch here, it has 5 sections, five images. We can go to the next image. This is the hand bones. As you can tell, this is the thumb, this is the index, middle finger, ring, and this is a small finger. When you put your hand together in front of or the MRI machine. When you go to the next frame, you're coming closer to the wrist. The same four fingers are adjacent to each other. I can magnify those from here. Right here. So that's the same, the forefinger and the thumb. You can now go to number 3. Are coming close now to the knuckles. As you can tell now, that is the thumb coming close to the index, middle finger, ring, and the small finger. So now we go to image number 4, number 5. That is all you can get in this localizer. Localizer are the tip of that. Let's go to the next one. And we can make that small or large. That is good. It has 9, you can see here it has 9 images. You can go to the next. Try to figure out which part of the body is that. It's called axial PD. It looks like I can see a bone here. I can see a joint here between a phalanx and that looks like the middle phalanx. That's the terminal phalanx, and that looks like the thumb from the side. Let's see when we come closer and closer. Okay, this is a nice picture. This is the hand, the right hand from the back. And I think we are going to zoom in, take it layer by layer. As you can see, this is the bone that looks like the muscles and the leg. Yes, this is the thumb. What is that long extension? Those look like tendons. Let us see the next image to make it clearer, because this is very superficial. Yes, these are the superficial muscles and tendons in the back of the arm, and you have the bones between them. This is number 6, and this is a cross-sectional in the bones of the cross-section in the bones of the hand. As you can see here, this is a muscle in the front of the hand under the thumb. I call it the thinner muscle, and this is the muscle of under the small finger, and this is the front. This is the front of the hand, and this is the dorsum or the back of the hand. The capital A is the anterior. Figure that out. It is not what we are looking for anyway. This is number 7. Number 8. We still cross section in the hand bone and the carpal bones of the hand. If you wanted to look closely, you can figure out what it is. That is the end of this one. This is number localizer. Let us have the axial. Okay, now we are in business. We are closer now. This is the thumb. This is the index, the middle finger, the ring, and the small finger. And we are going to move from the tips of the finger to the wrist. We have 24 images to do that. As you can see here, 24, number 24. We'll go one by one to see if we can discern any injury. Coming close, coming close, coming close. This is what is inside. Those are the ligaments in the front of the bones of the hand. The back ones are the extensors. The front ones, those are the flexor ligaments. Too many layers. I think 2 or 3 layers. The deeper layer and the superficial layer. And that white stuff, vacuum, it looks like the soft tissue. Because this is an MRI. Just zoom up more. We are now coming closer and closer to the wrist, where the bones are going to be. Don't know which bone is that, which bone is which so far. Until, of course, you can tell or you cannot. Because you have the capitate, you have the hamate, and you have the trapezoid, and the trapezial, whatever these the two bones are. Let us just keep moving, coming closer. Now it looks like we are getting clearer. Let us go more, closer to the wrist. We are at 14. We are not yet at the radius. Can go back to the radius and back off. Now this is the radius. This is the surface of the radius. This is the surface of the radius. When you look from the fingers, and here, as you can tell, and this part is too far from here, that will be the connection of the ulna with the radius, and that's supposed to be the ligament of the ulna and the radius. We can come closer to the body, which is proximal, and then we'll go back again. Here is a clearer shot between. We are going to go back to the front. This is for sure the radius, and this is the ulna, and this is supposed to be the ligament that surround the annulus ligament that surround the head of the ulna. What is this bone? Or is that the surface of the radius, or a cross section in it? But as you can tell, the radius doesn't look good. Is that damaged? Is that the vascularity of the cartilage or the bone? Does it not look good, or it is just my impression? We figure out to come back again to that later on. Now here is the ulna, and here is the radius. This is the right hand. No, this is the back of the hand, and this is the front of the hand. Of course, this have to be the front, because here is the artery right here. The artery have to come close to the bone. That is the artery, or that one. One of these is the artery, and those are the ligaments in front of the wrist. We are coming back now closer to going away from the body. Let us finish coming back all the way to here. Now this is as far as you can go away from the wrist toward the body. This is the ulna, this is the radius, and these are the muscles or the ligaments in the front of the hand away from the wrist joint. We can now move distally away from the body towards the finger one by one. As we can, we are going to trace each one of these joints as an ulna here and a radius here. And this is the back of the hand, or the dorsum of the hand. And this is the anterior of the wrist, the anterior of the wrist, or the front of the wrist. And this is the right hand. So now we move closer to the fingers. We come close. The head of the radius is getting thicker. The ulna is still shown. That structure, is it damaged, or it is the natural look of the bones? It looks like natural to me. Now the ulna is still there. The ulna did not disappear yet. It have to disappear when it come exactly at the wrist. The ulna is still there with the annulus. That is the annulus ligament around it. The ulna is going to, it looks like going to disappear quick. The ulna disappeared now. Why? Because you are here exactly at the wrist. So this is the surface of the radius bone attached to the scaphoid and the leonate. Is it damaged? Is that damaged? We will find that later on. Where did the ulna go? The ulna have to disappear from the view here, because the ulna does not articulate to the wrist. What is this bone? This bone, I think it's not the styloid. This is the tip of the ulna. Let us see if that is the tip of the ulna. Let's go back again here. We are now talking about, we are taking a section right here. Yeah. So this is this bone right here. This bone right here is going to show up in the X-ray. So and the ulna have to disappear on this gap. So this bone belongs to the ulna, the tip at the very far outside. I think they call it the styloid process. Mr. Rabli, I forgot the anatomy. It was just to go closer. So this bone is not in my concern now. Is it a concern or no? Because you still have to look at the contour of the bone. The contour doesn't look good. As you can see here, this is not a smooth contour. This is not a smooth contour. It seems like the radius is inflamed. This doesn't look good here. It doesn't look good. This does not look good. That is just my layman impression. Let us now go more distal. Now, start having here, my guess is that this is the leonate. We are now at the front. This got to be the leonate, and this got to be the scaphoid, and this is a damage, the separation between the scaphoid and the leonate. The radius is not here now because we are ahead in the front. How far ahead? We are right here. We are now taking an image at this section right here. So this bone is not going to show up. The radius is not going to show up. What is going to show up are these two bones. These two bones are supposed to close to each other. So if you take section in them, but if you look at where the injury happened, here where the damage occurs, there is a space here between these two bones. These two bones are not nicely connected to each other. You're supposed to have these two bones come here, this way. You're supposed to have this bone come this way, when the ligament between them, and they are not. Let us go back and forth to see. Okay, here is where the radius and the tip of the ulna. We are going back now. We are going again to the distal. Here is where the problem starts showing. A torn ligament in this area between the scaphoid and the leonate. When we go back more distal, now the problem most probably is more vivid here than what happened to the bone. This bone, this is the scaphoid, moved too far outside, and there is a gap between the two bones. And the radiologist said that you have arthritis because you have these cracked edges. If you look at the edges of this bone, these are not smooth edges. This bone is worn badly, and this also bone has problems here. Bones are not very smooth here. Now we are more distal. How distal we are? Let's go back here to see how distal we are. I think we are now at this level. So you have capitate, you have the triquetral, part of the scaphoid, and the part of the trapezium. That is the capitate. That's cross section. That's the capitate with the two parts, and that is the hamate, and that's supposed to be portion of the scaphoid. Of course, the leonate will not show in this part. Can you tell which ligament goes where? You have a shadow here. This is the shadow. This is a small bone that's connected to the thumb. Let's go back again to see. I think the most serious concern that was diagnosed as an advanced collapse. This portion right here is devoid of bones. There is no bone here, and the other bones are destroyed, are inflamed. So if you go back again, this is the radius, surface of the radius, scaphoid and the leonate separated. Separation is here clear, wider. Here is scaphoid start showing up in a different direction. This is a capitate, hamate, and the scaphoid looks like tortured with separation from the rest of the carpal bones. Go back to number further to the front or distal. Here is where the scaphoid is sitting neatly away where it's supposed to sit. This is the capitate, this is the scaphoid. They do seem to have a very nice space between, or you can say cartilage between them. And that location, away from the rest joint. This is the capitate, this is the hamate. Can you tell this is the ligament? This ligament, part of the ligament? You have to have a ligament from here to here, a ligament from here to here, a ligament from here to the leonate. And those are the flexors, tendon on the front of the hand. You go back to the picture of the tendons. This is the picture that we are counting on. This is the scaphoid right here. It has that ligament between the capitate, that ligament between the triquetral, that ligament between the leonate, and well, between the capitate and the hamate there is a separate ligament. And you have two other ligaments here to the side. Let us go back again to see if we can make sense of that. This is the radius surface. When you look from the front, the dorsal part, or the surface between the radius and the hand, this is the leonate and the scaphoid separated. Further distally, the scaphoid does not sit where it's supposed to sit. It sits away from the wrist, angled away from its tight contact with the carpal bones. This is the front of the hand. This is where all the flexor ligament in the front of the hand, the two layers, the deeper and the superficial layer. This is your knuckles are here. This is a capitate, this is the hamate, and this is supposed to be, is it a scaphoid? She put a marker here on the side. That marker is where the pain is, against in front of the scaphoid. Can you tell if you have any ligament damage from here? I'm not sure. Now we are going distally away from the wrist. Now this is easy to tell because here is the thumb, here is the index. That's number one. You come closer and closer. You start getting into the carpal bones. This cannot be the fingers, right? The fingers are separated from each other. Let's review the anatomy again. The anatomy here, okay, now that's much better. Those are the metacarpal bones. The metacarpal means the bones inside the hand. Those are the metacarpal bones. Those are the bones inside the hand. And here is where the knuckles are. This is your knuckles. So the thumb has two joints outside the hand. The index has 3, each one else has 3. So those are the metacarpal. That will help us more understanding what we see. So these are the metacarpal bones. 1, 2, 3 metacarpal, and that is the metacarpal of the small finger, and that is the metacarpal of the thumb. You come closer here. So we don't want to mix between the metacarpal and the carpal. Those are metacarpal bones. Those are metacarpal bones. Those are this metacarpal bone? Yeah, metacarpal bones, because the numbers are, this is the thumb, this is the index, and this be the middle finger. It is not round. It have to be. It must be the knuckles. Now we are in the hand bones, because they are angulated with each other, separate from the metacarpal. This is the carpal bones now. That's for sure. Because as you see, there are sharp. Those are not smooth, separate metacarpals. These are carpal bones, tightly articulated to each other with cartilage and stuff like that. And as you see, there are osteophytes here. This is the arthritis. If you look at here, this is arthritis. This is arthritis. Those are for sure metacarpal bones, which hamate, capitate, and most probably these are the 3 small bones. We can tell now when we go further. Yeah, this is metacarpal bones. And here where the scaphoid is. Here where the problem is going to start, between the separation between these 2 bones. This got to be the leonate, and this is scaphoid. They are separated from each other. Yeah, I think that's enough for this plate. That took a lot of work. This plate has 20 images. Yeah, so this is the hand from here, from away from the skin. Come closer, 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 closer. This is the right hand. Closer. Start now showing some formation of the bones. As you can see, the radius, this is what? This is T1. That is the radius bone. And here is supposed to be the beginning of the ulna. And this is the muscle. And most probably the diagnosis is right here. The collapse or the torn ligament between, this is the scaphoid, and this is the leonate in this area, and as you can see, there is a separation here. What is this marker outside? I think this is a marker. Let us come closer, deeper, and here where the problem happens. This is a separation right here. This is where the injury happened. That is the leonate here, and that is the scaphoid. And the injury happened between the 2. That space here, that's a good thing. Is that black surface here a good idea or something good or not? It is called stage 1 and 2. So far, you have only damage here to that bone, to the surface. You have damage to the surface of that bone, Yes, damage to the surface of that bone. I don't know if you have damage here also. You have damage here. You have damage here, and you have damage here, and you have damage here. All that is arthritis due to the abuse of the hand. You have also some damage here, and you have damage here. We go number 9, deeper. Would all that be damages? Does that mean damage here, damage here, damage here, damage here, damage here, damage here, damage here? Of course, there is an injury here, because these two bones are supposed to be stuck together with a ligament. There is another ligament between these two bones, here and here. There is another ligament between these two bones, here and here. So let us see if we can have some hope, or build some hope. Not really a false hope, but let us see if we can say something good. Suppose this ligament is torn, so the separation can be explained. You have a ligament here, it have to be torn also, because the bone, the scaphoid is gone. But there is a ligament here. I am not sure if that's torn or not. If you keep using it, not going to have that ligament back. The bad news is that you have damage here, damage here, damage here, damage here, damage here, damage here, damage here. Because you love your hand, you might fight back and say, I can build these things back. The doctor said, no, it's not going to happen. From my experience, you cannot trust the doctors 100%. The doctors are not scientists. They are just practical clinicians. They might be right. I have the damage here. This is my biggest problem. The scaphoid and the leonate are separated. I have damage here, damage here, damage here, damage here, damage here, damage here. When you are injured and you say, I don't trust doctors, nobody wants to listen to you because you are a patient now. You cannot treat yourself. Do I have damage? This is a thumb. The thumb, my thumb has a problem too. Now we are still in T1, as you can say. This is the T1 diagram. As you see, we have the damage in this portion, the separation between the scaphoid and leonate. Now we are going to the more other side of the body, where the soft tissue starts showing up and the bones will start disappearing. This is, I think, this is the cartilage between the thumb, or maybe the ligament between the thumb and the TM or the trapezium, and that might be the trapezoid bone. Now we're to the other side, or to the front of the hand, so the ligaments and the tendon are start showing up, and that is the thinner, and that is the two muscles of the front of the hand, or at the end of it. We finish that part. Let us go to the next one and see if that would. This has 20 images. Also, this is coronal, also GRE. What is GRE? Something more technical than I am interested in. Maybe it will help the pathologist or the radiologist make a determination on what is the problem. Does that do? This is the scaphoid, and this is the leonate, and this is the radius, and this is the ulna. Does that mean there is a torn something here? Of course, there is a wide space here. That wide space is a problem, because it's supposed to have a ligament here, it's supposed to have a ligament here, and you're supposed to have a ligament here, and you're supposed to have from the capitate to the hamate, you have to have a ligament. Let us see if any of that will make sense. We finished? No, we did not finish. This might just help the radiologist to make a determination here. Your hope is to close this gap by any kind of medical method, to avoid any surgery, if you can succeed. So let us go to the the end of it. That is over. So let us now go to the next number, coronal also, BR. It has 20 diagrams, 20 image. What is a coronal BR? It's going to get you more information. Those are the metacarpal bones, and those are the carpal bones. So let us make it clear. This is the radius, and this is the ulna is going to be in this area. It doesn't show up now. And this is the metacarpal bone number 2. Number 3, number 4 is hidden, and the number 5. And the number 1 is the thumb. And those here is the carpus, or the 8th carpal bone of the hand. So let us zoom again deeper to see if this image will show up something different. Yeah, it did show up. It did show up the damage here. Here is the damage. The scaphoid and the unit are separated. Yes. And there is a cracked surface of the radius bone, as you can see. There is a damage to the scaphoid itself. There is a damage here. There is that's what I call it, arthritis. Here is more drastic inflammation. You can damage on the scaphoid, damage on the capitate, damage on the hamate. Look at this damage. Also damage on the ulna, damage. Look at how the surface of the radius is damaged. Damage here. Here is the osteophytes that make it painful hand. Well, your hand is not very cheap, but when you hurt it, when you damage it, you start learning something. You never learn all your life until you lose it. Here is the bad news, the separation of these two. There is a damage. This is a notched bone. The bones are chopped. Damage. This is a barbecued hand. That is, can't tell anything. What is that missing? And this is the beginning of another surface that's covering up all these bones. To see, yeah, there's another soft tissue layer. So we finish this layer. Can this layer give us something? This is a sagittal layer. It has 20 layers. It did not help me a lot. Let us now go to the next, the hand. Run this program again. And we are going to start the hand. Open the hand MRI. MRI of the hand, it has, I don't think it has a lot of information that is useful. Let us start from the beginning of it. Those are the 4 fingers of the hand. It has 5 images. That is 1, 2, 3. The thumb starts showing. That is easy. Let us go to the next one. That is PD axial. It has 9 images. That's 1. Yeah, what is it going to do is most probably is try to document if there is any fracture in the hand. It did not help me a lot. Let us go to take this one. It has 40 images. Well, if you look at this, the first one, this is the tip of the middle finger, because we are coming proximally from the tip towards the wrist. These are the 3 fingers. the middle finger is the middle, and the index and the ring. And now you have the little finger, pinky start. Then now you have the thumb start. This is your thumb, and this is the pinky, and this is the middle finger. And it's just going through them to see if there is any fracture or any disturbance to the hand. We're coming closer and closer. Now, I think now we are going through the metacarpal bones. We finished. Thank God it's finished, because there is not much I can learn from here. This is 20. What is this? This T1. This is the hand. Of course, this is the right hand. This is from the back, taken from the back to the front. We are now, these are the knuckles or the metacarpal bones. It did not tell me a lot. This is T2, 20 bones. Most probably all it will say that the bones are not fractured. Not the bones, because this is an MRI, it's not dealing with bones. That is STR. So the problem now is at the wrist. This is 23. It is it did not help me a lot.